So first and foremost, not every single patient that has an ACL injury or ACL rupture needs to have an operation. So that's the key first message. In terms of when is ACL surgery necessary, it really depends upon the patient. And what I mean by that is the patient's symptoms. So if the patient is having lots of episodes of giving way or instability of the knee after they've injured their ACL, they're quite relatively youngish patient who wants to get back to their levels of activity, which may be sports, then surgery would absolutely be an indication to reconstruct the anterior cruciate ligament. In terms of how does the surgery work? So there are a couple of things. So one is the surgical side of it, the anatomical side, and secondly is the rehabilitation. So both of these things work in combination. The surgery itself involves taking a graft, which can be either from the hamstrings or the tendon underneath the kneecap, which is called the patellar tendon, where we pass this through the bone in the top of the shin bone into the thigh bone. How does it work? It helps to stabilize anatomically the knee joint, and it works in combination with the rehabilitation, which is essentially the physiotherapy, which involves things like strengthening a range of motion exercises and balancing exercises. A complete ACL rupture does not heal. Sometimes partial ACL ruptures may heal. In terms of how does an ACL recover, it's actually not only the ACL itself, but the surrounding structures. So what do I mean by the surrounding structures? The key things are the muscles around the leg, which help to support the knee joint, which have to be strengthened to help to improve the symptoms of stability. And the key facts about recovery also include the rehabilitation, which is the proprioception of the balancing exercises, which help to reduce the risks of giving way, the strengthening and the stretching. The recovery process for ACL injuries is variable. It depends on a few factors. So number one, very importantly, it depends on the patient factors. Number two is the actual nature of the ACL injury and the degree of where it's torn. And number three, it's secondary to any associated injuries that may occur in terms of the ACL rupture. So sometimes you can have other ligaments ruptured, or you can have tears of the cartilage. In terms of how long does it take, it can be extremely variable. For small partial tears of the ACL, it can take 6 to 12 weeks. And with other larger, greater levels of injury and patient factors, it can take, incorporating the rehabilitation and the non-operative treatments, it can take anything from 6 months to even up to 1 year for you to have a recovery from this. Sport and other activities can definitely be incorporated into the recovery process for ACL injuries, which are treated either non-operatively or operatively. The way that this is done is in a guided format with the physiotherapist and obviously the patient. This is done in a gradual way. This involves starting off the recovery or the rehabilitation, initially doing gentle things such as walking, stretching, balancing exercises, and then building in lower levels of the sport. For example, you can start off gently after a few months, maybe 3 months or so, gentle jogging, and then build yourself up to sport specific rehabilitation. And we actually recommend, as part of ACL reconstruction recovery, sport specific exercises and rehabilitation programs to give our patients the best chances of returning to their high level of sport. This, in terms of time, can take anything from 6 to 9 to even 12 months, depending on the patient and the sport involved. So strengthening the ACL does not necessarily mean strengthening the ACL ligament itself, essentially. Strengthening involves strengthening of the surrounding muscles, and these include the muscles which are the quadriceps, the hamstrings, and the calf muscles. Initially, we start off with simple things like for strengthening, which include walking, and then building things up with the physiotherapist. Then we undertake different programs with weight training and different specific exercises, which may be initially what we say closed chain exercises, and then we progress in terms of the level of weight and the level of force that we put through into the ACL itself.